Ever pondered over the mystery behind a persistent fever that defies diagnosis? This enigma, known as pyrexia of unknown origin or PUO, has intrigued and challenged the medical world for decades. So, what is it that makes this condition so elusive? Buckle up as we delve into the mystifying world of pyrexia of unknown origin. First, let's demystify what PUO is. Coined in the 1960s, the term pyrexia of unknown origin was initially used to describe patients who had a fever higher than 101 degrees Fahrenheit for 3 weeks or longer, and whose diagnosis remained unclear after 1 week of investigation in the hospital. However, with the evolution in medical diagnostics, this definition has been modified over time to encompass patients with prolonged fever that remains undiagnosed after intensive investigations. Now, onto the causes of PUO. Broadly, they fall into 4 categories: infections, malignancies, non-infectious inflammatory diseases, and miscellaneous causes, which include drug fevers and factitious fevers. Infections could range from the common tuberculosis to the rare Whipple's disease. Malignancies could be as widespread as lymphomas or as specific as renal cell carcinomas. Non-infectious inflammatory diseases include conditions like systemic lupus, erythematosus, and temporal arteritis. However, despite extensive investigations in about 15 to 25% of patients, the cause of the fever remains unknown. Moving on to symptoms, apart from the prolonged fever, symptoms can vary widely depending on the underlying cause. They may include fatigue, weight loss, night sweats, or localized symptoms related to the infection, malignancy, or the inflammatory disease. When it comes to treatment, it is tailored to the underlying cause, if identified. For example, if the cause is an infection, antibiotics or antivirals are used. If it's a malignancy, chemotherapy or radiation therapy may be employed. In cases where the cause remains unknown, symptomatic treatment is provided to manage the fever and improve the patient's comfort. In conclusion, pyrexia of unknown origin is a complex and challenging condition. It's a fever that persists for a prolonged period and resists diagnosis despite intensive investigations. Its causes are diverse, ranging from infections to malignancies, non-infectious inflammatory diseases, and even unexplained factors. The symptoms vary depending on the underlying cause, and the treatment is tailored to the cause, if identifiable. Despite its complexity, understanding PUO is crucial in advancing our knowledge and treatment of febrile illnesses. The quest to unravel the mysteries of PUO continues, reminding us of the boundless enigmas that the field of medicine holds.